Gentlemen, let's talk honestly for a moment. Have you ever found yourself staring in the mirror or standing in the bathroom, silently wondering questions you'd never say out loud? Questions that stay tucked in the back of your mind because you assume no one else thinks about them? Maybe you've wondered, how do those guys in adult films look so huge? Is there a secret I don't know about? Or maybe you've been caught off guard at the toilet. You start to urinate, and suddenly the stream splits into two directions, like a rogue sprinkler, hitting the bowl, the floor, and everything you weren't aiming for. Or perhaps your most private worry comes from the bedroom. Those moments when you're with your partner, everything feels right, until you start thinking too much. The pressure builds, your heart races, your mind gets loud, and suddenly your erection starts slipping away like a light dimming. If any of these thoughts have ever crossed your mind, let me tell you something important. You are not strange. You are not alone, and there is nothing you are feeling right now that countless men haven't quietly carried inside themselves. Today we're going to bring those questions out of the shadows. We're going to replace shame with understanding, and we're going to talk about what's really happening inside your body, physically, hormonally, psychologically, and emotionally. From 19-year-olds terrified by their first unexpected erection loss, to 72-year-old husbands worried about their changing urinary stream. And when men talk to me, especially behind closed doors, they're often relieved to finally say the things they've bottled up for years. So today, I'm going to walk you through the 3 most common concerns men whisper about, but rarely discuss openly. Why performance anxiety quietly sabotages erections. The real truth behind porn star size, and what those actors actually do. Why urine sometimes splits, sprays, or changes direction. And when it's a sign to check your prostate. Then, at the end, I'm going to give you a step-by-step action plan so you can finally feel in control of your body, your confidence, and your health again. Before we begin, do me a quick favor. Hit the like button so this information reaches more men who need honest, compassionate answers without shame or judgment. And comment below. Tell me where you're watching from. I love seeing men around the world supporting each other. All right, take a breath. The first elephant in the room. How overthinking destroys erections. Most men believe that if their erection fades even once, something is permanently broken inside their body. That is not true, not even close. In reality, one of the most common causes of sudden erection loss, especially in young and middle-aged men, is psychological, not physical. There's a clinical term for it. Psychogenic erectile dysfunction. But let me explain it in a way that makes sense. The first time an erection weakens unexpectedly, it feels like a shock. It catches you completely off guard. The second time, you're already worried it might happen again. Your mind starts racing before your body even gets a chance to respond. By the third time, you're so afraid of losing your erection that your nervous system flips into survival mode. Your heart beats faster. Your breathing changes. Your muscles tighten, and most importantly, your body redirects blood flow away from your genitals. Not because you're broken, not because you're weak, but because your brain is sending a message of danger, even though the danger is just your own thoughts. Your nervous system has 2 modes: parasympathetic system, rest, relaxation, arousal. Sympathetic system, stress, fight or flight. You can't be in both at the same time. If the anxiety switch flips, arousal shuts down. This is why men tell me, it works fine when I'm alone, but not with a partner. If we take a break, it comes back. The moment I start thinking about it, everything collapses. That's not failure. That's physiology. And emotionally, it can feel crushing. It makes you question your masculinity. It makes you fear intimacy. It makes you retreat inside yourself. But here's what I want you to hear. This cycle is extremely common. This cycle is reversible, and this cycle is not a reflection of your worth. Research shows that almost 87% of erectile issues in younger men come from psychological causes or early cardiovascular changes, not permanent physical damage. This means 2 important things. If you're under 40 and struggling regularly, it's worth checking your heart, hormones, and circulation. Not because something is broken, but because early changes show up in the penis before they show up in the heart. If your medical tests are normal, the problem is almost certainly anxiety, and anxiety-based ED can be retrained and corrected. As a doctor, I've seen men rebuild their confidence and performance, even after years of fear, simply by addressing the cause instead of the symptom. We'll discuss the action plan shortly, but let's move to the next concern men rarely talk about: the truth behind porn star size. Let's be honest, every man at some point has compared himself to what he sees on screen. But here's the part no one tells you. Adult films are not biology. Adult films are business. The average erect penis worldwide is about 5.4 inches. 99% of men fall between 4.3 and 7.2 inches. So why do performers look enormous? Reason number 1, selection. Biased producers choose actors with above average size. It's the same reason basketball players are tall. The industry selects a specific body type. Reason number 2, camera tricks, lighting, angles, distance, and editing make everything look larger. If you put any object closer to the lens, it appears significantly bigger. This is not your anatomy failing you, it's cinematography. Reason number 3, medical aids. This is the part most men never hear. Many adult performers use vacuum pumps to temporarily swell the tissue traction devices to increase length over time, dermal fillers injected for temporary girth, tadalafil or sildenafil before shooting, and in rare cases, implants that create reliable erections on demand. This is not natural biology. This is preparation, enhancement, and production strategy. And here's something crucial. Size has very little to do with a woman's pleasure. What matters most? Blood flow, erection, quality, rhythm, emotional presence, confidence, communication connection. A man who is attentive, present, and confident provides far more pleasure than a man who is simply large. Comparing yourself to performers is like comparing your living room singing to a Grammy performance. It's the wrong measuring stick. Let's move to the third concern. As a doctor, I've seen men rebuild their confidence and performance, even after years of fear, simply by addressing the cause instead of the symptom. We'll discuss the action plan shortly, but let's move to the next concern men rarely talk about. When your urine splits or sprays, it happens to almost every man at some point. You stand at the toilet, start to urinate, and suddenly the stream splits in two, spraying in different directions. It looks strange. It feels strange, and men almost never talk about it. Here's the truth. Most split streams are harmless. The opening of the urethra is small and delicate. If there's dried semen, mucus, or residual fluid at the tip, it can temporarily block part of the opening. When the urine pushes through, it forces the stream to split. But there are other causes worth understanding. 1. After ejaculation, residual seminal fluid can temporarily cling to the urethra's opening and alter the stream. 2. Urethral inflammation. Mild irritation can cause swelling that changes the direction of flow. For enlarged prostate, BPH. If you're over 45 and notice weak stream dribbling hesitancy, frequent nighttime urination, difficulty initiating flow, it may be an early sign of prostate enlargement. 4. Urethral strictures. Scar tissue narrows the passage, changing the stream's shape. Men often ignore these symptoms, assuming they're just part of getting older. But urinary changes can tell us a great deal about prostate health, bladder function, and long-term well-being. Now, let's bring everything together into a clear, practical plan. If you struggle with psychogenic ED, get basic medical checks to rule out heart, hormone, or circulation issues. Shift the focus away from penetration. Rebuild confidence gradually. Use guided intimacy instead of performance pressure. Consider therapy to break the fear loop. Low-dose tadalafil can help maintain erections while you retrain your nervous system. Healing anxiety-based ED is not about fixing the penis. It's about calming the mind so the body can respond the way it's designed to. If you are comparing yourself to adult films, stop benchmarking your body against staged, edited, medically enhanced performances. Focus instead on circulation, stamina, core health, and confidence. If you're exploring size-enhancing devices, stick to safe, medically approved traction methods. Avoid surgeries unless medically necessary. Risks are high, and results often disappoint. Your value is not measured in inches. Your pleasure-giving ability is not defined by size. And your masculinity is not tied to unrealistic standards created for entertainment. If your urine splits or your prostate is changing, try these. Sit while urinating, especially in the morning. Stay hydrated consistently. Fully empty your bladder. Monitor symptoms like hesitancy or frequent nighttime urination. If symptoms persist, see a urologist. BPH is extremely treatable and easier to manage early. A supplement containing saw palmetto, pyjum, green tea extract, and nettle root may support prostate health by reducing inflammation and improving flow. Gentlemen, listen closely. If you've ever felt embarrassed about your erection, your size, your urine stream, or anything else related to your sexual health, please hear me when I say, you are not broken, you are not failing, you are not less of a man. Your body is constantly speaking to you through changes, signals, sensations, and responses. These aren't warnings of inadequacy. They are invitations to understand yourself more deeply. Masculinity is not measured in inches, or in the strength of a single erection, or in the direction of a urine stream. Masculinity is measured by your willingness to learn, your openness to growth, your ability to care for your health, your desire to connect authentically, your courage to ask questions, your resilience in overcoming challenges. Your body is adaptable, your confidence is rebuildable, your health is in your hands, and you deserve a life where intimacy brings joy, not fear. So let me ask you, what is one healthy habit you're beginning this week to support your mind, your body, or your confidence? Comment below. Let this be the moment you take one step, even a small one, toward the healthier, stronger, more confident version of yourself that already lives within you. If symptoms persist, see a urologist. BPH is extremely treatable and easier to manage early. A supplement containing saw palmetto, pyjum, green tea extract, and nettle root may support prostate health by reducing inflammation and improving flow.